Am I clearly audible? Am I audible? Am I audible to everyone?
Yes, you're audible. Please go
Okay,
ahead.
thank you. First of all, to begin with, good evening to everyone present over here in this session. Before beginning, I would like to thank the organizers for providing us this opportunity to present our research paper through this presentation. And I'll just give a info about the authors of the research paper. It's me, Karthikeya Yadav from Law Center 2, Faculty of Law, Delhi University. Currently, I'm pursuing my LLB, and my co-teammate is Nikita. She is pursuing her Eco Honors, BA Honors Economics from Gargi College, University of Delhi itself. Now, before giving an an introduction about the topic that we have chosen, the topic, which was a very vast topic that was given to us, was mental health, and we delved it into a specific intricacy to it, was relating it with the youth. So that's why, to make it much more catchy, we termed the paper as Generation Z and the Mental Health Crisis and Dilemma. So the research paper focuses on the mental health dilemma and crisis faced by the Generation Z. I'll be further delving what is Generation Z. And before delving, I would like to I'll give a brief definition what falls under Generation Z. So it encapsulates in it people who are born on or after 1997 till 2013. So basically it involves people like us who are college grads or school students. So mental health of the youth has been affected worldwide due to various factors. In our research paper, prime focus has been given to social media's impact on mental youth and COVID-19's impact of mental youth. The paper is structured in a format through which it provides the what, why, and how of the problem of mental health crisis and the necessary reforms that are required. We have delved into it later on in the last stage of the research paper. So, one of the main factors which contributed to this crisis of mental health is the constant pressure to perform and present a curated image of oneself on social media. Generations of Generation Z often feel like they have to live up to the unrealistic standards set up by influencers and celebrities, which can lead to feeling of anxiety, depression, and low self-esteem. In addition to it, Generation Z has also to suffer due to COVID-19 and its impact on their mental health. As youth is the era when the mental well-being of a person is very much required, because a lot of evolution is going on in our body itself. And finally, access to mental health resources remains a challenge for many of the Generation Z people, particularly those from marginalized communities. Now I will further move on with the significance of the paper and the topic chosen by us. As in the status quo, mental health plays an important role. With time, stress, tension, and workload had increased, and humans are trying to develop and evolve, going on this progressive path, once mental health is majorly not taken into consideration. And through this paper, we have tried to provide a solution-centric approach to the problem by suggesting changes and reforms into the mental health policies and legislation of our country itself. So the objective of the paper, we have bifurcated into three main subpoints. The objective of the paper was to collect data and get to the conclusion upon the health of the Generation Z. How is it, what is it, and what could be done regarding that. And to find the impact of COVID-19 and social media on the mental health of the youngsters. And number third, to look for set up policies and what needs to be done or improved. For this, we have taken reference to literature reviews. Data sources which we included also include United Nations and its organizations reports by UNICEF, UNHCR, and other reports as well, of latest reports of 2022 and 2021. And further reliance was also placed on knowledgeable and highly intellectual papers written by Mr. Virendra S. Chauhan and Dr. Sukriti Chauhan titled Mental Health in India and a Perspective, and a paper titled Mental Health Problems Among Youths in India and its Correlates, written by Ms. Kirti Gore and Ms. Usha Rani. Further, for the methodology, we have made a Google form in the format of a questionnaire to collect responses from youngsters and students in reference to mental health and youth. Our main prime focus for the students of colleges and schools itself. And responses were taken through one-on-one interaction as well from our respective colleges, both the teammates colleges. And the responses have helped in making
Yeah. So now I will be telling you about the results that we received from the questionnaire. So about 72.1% of our respondents have not seen a therapist in the recent past. And to add on, 56.8% have never got their mental health examination done. As the majority of the youth have not got their mental health examination done, and have not seen or visited a therapist in the recent past, it showcases a major concern. Further, 52.3% state that they have not been diagnosed with mental health disorders, facing mental health illness and issues related to mental health. People are going through mental health issues and due to the stigma attached to it are not going to therapist. Thus, 52.3% people who are stating that they have not been diagnosed with mental health are just claiming this thing without even getting a mental health checkup, although enough of them have gone through a mental health crisis. 79.3% has a major effect on their mental health from social media, and only 20.7% has no effect. Social media and digital technologies are escalating feelings of anxiety, interfering with sleep cycles, encouraging cyberbullying, and distortioning body images. About 70.5% say that COVID 19 has impacted their mental health. Children's mental health was significantly impacted by having few or no opportunities to play outside and interact with others, which made them more prone to boredom, aggression, and occasionally sadness, as well as to mental stress. Now, we will be moving forward to policy suggestion. As as we know, India is a country with large youth population, and the mental health of this demographic is an important issue that needs to be addressed. Here are some of the policy reforms and suggestions for youth mental health in India. First is increase access to mental health services. The government should increase the number of mental health professionals and clinics across the country. Telemedicine can also be used to provide mental health services in rural areas where there is a shortage of mental health professionals. Second, integrate mental health into the school curriculum. Schools can play an important role in promoting mental health among young people. Mental health education should be integrated into the school curriculum, and school counselors should be trained to provide support to students. Address stigma around mental health. There is still a lot of stigma attached to mental health issues in India, which prevents many young people from seeking help. The government should launch public awareness campaigns to reduce stigma and increase awareness about mental health. Next is increased funding for mental health research. More research is needed to understand the causes and treatments of mental health issues in young people. The government should increase funding for mental health research to support the development of effective interventions. Next is to promote the community-based intervention. Community-based interventions such as peer support groups and community outreach programs can be effective in promoting mental health among young people. The government should support the development and implementation of community-based intervention. Ensure access to affordable mental health care. Many young people in India cannot afford mental health care. The government should work to make mental health care more affordable and accessible to all, including those from marginalized communities. By implementing these policy reform and suggestion, India can work towards promoting the mental health of its young population and ensuring that they have the resources that they need to lead healthy and productive lives. Now, I will like to conclude this presentation by saying that mental health is a reality which the youth is facing worldwide. A collaborative approach needs to be established between various international national organizations and between countries. Even vigilant citizens like us need to help people surrounding us facing mental health issues. Thank you.